Let's talk a little bit about what's happened in Texas. You're at the University of Texas, and you are working a lot in water quality issues in your state. And Texas has had some unique events in the past years. Most recently, the historic cold weather event that happened, the freeze that resulted in busted pipes and infrastructure problems and water delivery problems, water quality problems. What can you tell us about that event and about the water quality during that time and mitigation strategies that the state or individual households used to combat that?
So really, it was eye-opening for the state of Texas for a couple of reasons. And one, we know that many Texans, like Americans, just lack access to this basic amenity of quality drinking water. And so that really became to the forefront because those people suffered even more. But then we had lots of people who did not have access to potable water. Also showed everyone how utilities are interconnected, whether we're talking about the electric company, the water company, or the gas company. And so when a utility is having a problem, that affects other utilities and especially with electric companies and their ability to generate water. We depend on the electric companies. And what was interesting about Texas, especially since I am with UT Houston School of Public Health, and we have 6 campuses around the state. And so the El Paso campus of UT Houston was the only one not affected because I learned really quickly that we are on a different power grid. So El Paso and the Paso del Norte region are on the electrical power grid with New Mexico and Colorado. So we were not impacted by what happened with a private company that they lost power and they didn't have the resources or the resiliency built in to combat this unexpected winter storm that then just had a domino effect on what was happening, how it affected the people there. The water quality became compromised, and there was a lot of media outreach trying to explain to customers when not to use the water, if how to boil the water for how long, if you can do that, and the different ways they could still use the water. And there was so many questions. Can I brush my teeth? Can I wash clothes? Can I run the dishwasher? Can I cook with it since I'm going to heat the water but just not drink it straight from the tap? And that caused a lot of confusion throughout Texas, and especially because the winter freeze, touched almost the entire state.
And of course, there was Hurricane Harvey back in 2017, a similar event. And some of these storm and flooding events, models are predicting that they're going to become more common. So, what can you say about that, or specifically to Hurricane Harvey in your state?
So again, the media outreach, I mean, it was effective in that they reached a lot of people and getting information out there on resources, but some of it was confusing about the water quality. So we know when there's a hurricane and there could be a flooding event, whatever's circulating in those flood waters is what's likely circulating in the community, especially if there's a breakdown in the sanitation infrastructure. And so some of the mixed messages that came out of the media, one had to do with coliform bacteria found in the water that is non-disease causing. It's an indicator of water quality, but we all knew that the water is not going to be of high quality when we're talking about flood waters. But the media focused a lot on the levels of coliforms in the water, and those are not disease causing. So the way it was presented made it seem like people should be fearful of those types of organisms. The other factor was finding Vibrio, and there was rumors then that cholera was circulating throughout Houston, and that was not the case. It was a different type of Vibrio that's commonly found in hurricane floodwaters, and that is not the causative agent of cholera. So there was a lot of confusion and misunderstandings and frankly fear because of that.
Right. And fear is a big driver of behaviors, and it's really important to have proper communication about what's going on. But we talk about boil water notices as a mitigation strategy when there is a flooding event or the potential for the drinking water supply to be compromised or not treated to the full capacity. But boil water notices, sometimes it's hard to get that information out. That's a confusing process for people. How long do I boil my water? What am I really concerned about? Mm-hmm. What if there are chemical contaminants that could be concentrated by boiling water? So We look at other strategies like point of use water filtration as kind of a consistent, more proactive approach for water treatment. What are your thoughts about point of use and point of entry type systems as mitigation strategies when these events might occur, when they're really kind of unpredictable of when you might be in a water quality crisis?
Right. Well, I think, I mean, you touched on it. The unpredictable nature of these events is what taught us that we're not prepared, and thinking, well, then we'll just turn to bottled water as the answer. That's not going to be the answer. That was a disaster in Texas in February, trying to provide those who were trying to provide bottled water to residents throughout Texas. It was very difficult, and bottled water was in short supply as well. Definitely point of use treatment devices are recommended. It's a conversation that we've been having here in El Paso with the medical community regarding water quality. There's some initiatives in El Paso in particular because of our water reuse program that El Paso Water has implemented. And we've talked about how bottled water is not regulated by the EPA. It's regulated by the FDA under some different guidelines, and that a point of use device could be really useful for households, and not just during an adverse event, but we've talked to physicians about how they need to think about their patients, but also where they live and their source water quality. And many people, myself included, until I got into this field, don't know where their drinking water comes from.